Have you ever experienced the unbearable pain from leg cramps? If the answer is absolutely yes, trust us, you are not alone in this case. Around 50 to 60% of adults and 7% of children have experienced leg cramps, not to mention the discomfort and pain that go with leg cramps. Leg cramps are common with no specific causes and remedies. Regardless of the causes, leg cramps can be too hard to handle. So how can you stop the pain and prevent ones from happening? Luckily for us, there are several methods that you can do to relieve the pain and possibly prevent leg cramps. First, let's listen to some interesting facts on leg cramps. The calf muscle is the most common area affected by leg cramps. Leg cramps can last for around 2 to 9 minutes, but the pain can linger for about 24 hours. Elderly people and pregnant women are most likely to have leg cramps. Both men and women are equally affected. In most of the cases, leg cramps are totally harmless and have no medical significance. Still, they can be linked to several underlying issues, including dehydration, diabetes, and alcohol abuse. As we previously mentioned, there is no particular reason for why leg cramps happen. Here are some possible causes of leg cramps. Leg muscles not being stretched due to our sedentary lifestyle. Less walking, more sitting is believed to cause leg cramps. On the other hand, standing all day or intensively exercising can also cause leg cramps. In this case, your muscles are overstressed and become fatigued. Scientists stated that muscle fatigue is the main trigger of leg cramps. Another possible cause is the way you sleep, particularly in an uncomfortable position. For instance, if you sleep on your stomach with your toes pointed away and your calf muscle shortens, a small movement can lead to leg cramps. Hence, you should avoid sleeping on your stomach. Try sleeping on your side with your toes neutral to prevent leg cramps. You can prop your feet up with a pillow as well. You can experience more leg cramps in the summer than in the winter. The reason why is in the summer, you have greater exposure to the sun and the level of vitamin D. Such change can lead to the activeness of nerve growth, which can trigger leg cramps. The fourth reason is dehydration. Dehydration leads to muscle fatigue and the promotion of electrolyte imbalances, which triggers nocturnal leg cramps. It is easy to stay hydrated just by drinking more water, don't you think? Adults are more likely to experience leg cramps than children, suggesting that the possibility of having leg cramps increases with age. When people get older, they lose muscle mass, which puts a lot of stress on the remaining muscles. This in turn leads to the occurrence of leg cramps. Pregnant women can experience weight gains and disrupted blood circulation. Moreover, the growing fetus can put more pressure on the mom's blood vessels and nerves, which in turn trigger leg cramps to happen more occasionally. Another reason why leg cramps are common among pregnant women is the increasing likelihood of magnesium and potassium deficiency during pregnancy. We come to this issue in the next point. Some studies show that the lack of nutrients, more specifically calcium, magnesium, and potassium, can lead to cramping. Imbalances or the lack of these nutrients can lead to the imbalances of fluid in your blood and muscles. And that is why leg cramps happen often, more in pregnant women. Another cause is the side effects from the current medications you're taking. These medications include diuretics and asthma drugs. These medications can affect some neurons and receptors, which in turn promote leg cramps. Other causes of leg cramps include structural disorders and metabolic problems, such as kidney failure and diabetes. Medical problems such as alcohol abuse, diarrhea, muscle fatigue, and nerve damage from cancer treatments can trigger leg cramps to occur. In the next section, we will discuss some of the best methods that you can use to relieve your cramps. These methods are easy to follow at home with some simple tools. The first method is stretching your calf muscles with a towel. Simply wrap the towel around your foot, sit with your cramped legs straight, and pull the towel towards yourself. You will feel better as the stretch helps to compress the leg and massage it. You can also try other stretching exercises, such as leaning forward in a sitting position. This stretches your inner thigh. You can also lie down and lift your legs straight up to stretch your hamstrings. After stretching, you can gently massage the area to ease the pain if it still lingers. The second method you can try to relieve your leg cramp pain is applying heat with a heat pack or a warm towel to the painful areas. A hot bottle of water can be a great help as well. Alternatively, you can use cold packs. Another method to help reduce the cramp is to take a warm bath or shower. You can consider taking medications to help relieve the pain. You should consult your doctor for your over-the-counter painkillers you can take in this case. Quinine is no longer used as a treatment of leg cramps as it can lead to some adverse side effects. You can also ask your doctor about taking calcium channel blockers as well. You can try these above remedies when leg cramps occurs. However, you might be familiar with the phrase prevention is better than cure, right? Let's check out something you can do to prevent leg cramps from happening in the first place. Remember that lack of nutrients and water can lead to leg cramps. Do eat a balanced diet and drink a lot of water. Make sure you eat food which contains a lot of magnesium, such as beans, nuts, and green vegetables. While you should drink a lot of water, avoid drinking too much alcohol. Alcohol abuse is a possible cause of leg cramps, and it is not good for your overall health at all. If you are pregnant, consult your doctor about taking magnesium supplements. Before you go to bed, stretch your leg muscles. Doing some exercises such as jigging your legs or stationary bicycling can help as well. Sleep in loose bed sheets instead of tight ones so that your feet and toes will not point down when you sleep. Avoid some certain drugs that can trigger leg cramps, such as diuretics, which are used to treat high blood pressure, and statins and fibrates, which are used to control high cholesterol. Consult your doctor for alternative medicines. Overall, leg cramps are considered not to be a severe medical problem, but you should consider seeing your doctor in some specific cases, such as when leg cramps happen more often than usual, when the pains are severe and too much for you to bear, when they go with symptoms including muscle weakness, leg swelling, or redness, when there is nothing you can do to relieve the pain. If you find our short video informative and useful, don't forget to like, subscribe, or comment below. See you in our next video.